CareAware Patient Flow is an application that we use to manage the flow of patients through our facility into and out of. So we use it in order to manage patient movement, to do bed turnover, and to keep our patients in a comfortable bed as opposed to a waiting queue as in the ED or in surgery. From a patient perspective, their experience is improved if they have less time waiting for movement. And we've seen within our own use of patient flow that transfer time, time to discharge, and time between units has dropped dramatically. So patients are spending more time in a comfortable room as opposed to being in transport or waiting for transport. With patient flow, we can tell our patients, your room will be ready in about an hour, it is being cleaned now, we are moving you to that location, so they have a better understanding of where they're going and when they will be moving. What we find with clinicians is they're better able to do time management so they can understand what beds they're going to be filling, what type of patients are coming, what their acuity level is, and what type of preparation they need to do to receive the patient. We also find that EVS is more able to adjust their workflow because as the patient ebbs and flows through the hospital, they can move from zone to zone to hit the hotspots where we're having a higher number of beds that need turnover as opposed to being on a unit where just one bed needs to be changed over. In general, it was a very positive response. Typically, when we make a change in technology, initially there's a lot of frustration with learning the new technology. In the case of patient flow, we didn't see that. What we saw was nearly immediate appreciation of I can see what I'm doing and what's coming. The additional information helped the clinicians and the people managing the environment to do a better job. They were extremely engaged and very curious about how it was going to improve the patient experience and what information they needed in order to take care of the patient. So very positive response. The simplest way to think about CareView CareAware dashboard is to think of it as the new whiteboard for our units. It's a dynamic way to look at a patient's status and what they need. We just found a much more dynamic approach. And that's what I love about CareView is that it actually increases overall interaction and communication with the clinicians. It was really an amazing thing to watch. The benefits of integration between CareAware CareView and CareAware Patient Flow for us at Adventist Health had a lot to do with how we manage the patient through the system. So we came up on CareAware CareView and we saw initially a really good conversation between clinicians managing the patient, and we saw some improvement in discharge time and management of the system.